Welcome to another episode of Cutting Edge Health. If we haven't met, I'm Dr. Orlando Landrum. I help patients understand how to be able to heal both brain and body and how to get back to leading the life that they deserve. Today, we are talking about posture and pain. If you do any type of Google search, ask your friend or talk to any family member or just a person on the street, they're going to tell you that posture is automatically equated with pain. So let's say you did a quick Google search or a YouTube search. You'd get videos that would look like this. You'd see them telling you how to be able to fix back pain and poor posture by doing an exercise, or how to be able to sit better, or how potentially to be able to focus on different body parts that look at what's your routine for fixing your neck and your shoulders in order to be able to improve your pain? Are there other exercises you can do for better improvements of posture? And at the end of the day, you can fix back pain by not slouching and being better. In theory, it's what your mother always told you. Don't slouch at the kitchen table, because if you do, your back is going to hurt. The question that I would pose to you and to those that put out those videos is, are you serious? So let's get into a little bit more depth and detail of understanding this, and let's really look at the literature to be able to get some understanding. So one of the things that we see is that musculoskeletal disorders are probably the biggest things that cause most of back pain, right? But there is still controversy about whether posture, poor posture that is, equates to spinal pain or back pain. And what they've been able to see is that despite using different things like bracing or different tools that correct areas of posture, it doesn't always result in improvement in pain. It's a fallacy. But let's dive a little bit more deeper into the details of, is there exceptions to the rule? Are there differences? So let's use Cleveland Clinic as its definition of when it starts looking at posture. And one of the things that it does is it kind of defines what is good posture. So good posture is maintaining one's head over above one's shoulders, shoulders above the hips, and lower body in a stable position. And different ways to be able to potentially improve this is by activating core muscles, by being able to wear well-fitted shoes and to eat well and exercise, which sounds like a generic description for health. But there is a portion of this article that really goes into a distinguishment, which I do think is pretty darn key. And that's the following. It looks like static posture and it looks like dynamic posture. So I know that sounds like fancy terms and I get it. I know it's starting to kind of get like, what is static and what's dynamic? But the fact of the matter is, as we always do in these different videos, we are going to explain it so that you don't just kind of just leave and turn around. We don't want that. We want you to understand, although it is science, we are going to explain it so that you get it. Okay? So static and dynamic. So static is posture that's related to being stationary. It's how you hold your body when you're not moving. And that can be in a number of different ways. It can be when you're seated. It can be when you're standing. But basically, it's non-movement. Dynamic posturing is when you move your body, and how does your body relate kinesthetically when you're in movement. So everything from sports to yoga or other things. So historically, we've been told that you only move certain ways when you're lifting weights or doing things. And so if you look on the boundaries of this cartoon on the left and the right-hand side, the left is representative of static posture, seated position, and supposedly is not good when you're in a flex position. And the right would be evident of dynamic posture. So you're bending and your hips aren't over, your shoulders aren't over your hips. And so you're putting your back exposed and at risk. While the direct stand-up kind of like seated position, where all those things as mentioned originally are kind of the classic way to be able to define how to be able to improve your posture. Or is it? So let's talk a little bit about how skeletal alignment may make an impact. So when we look at the skeleton, in this context, we're looking from a sideways view. So if I was kind of giving representation so you can understand that, it would be as if we were looking at a model kind of like this, right? And you could see that there's an anterior and a posterior component. The front of the body's here. The posterior portion, the back portion's back here. This is where your bottom and your tailbone would be. Up here would be where your stomach would happen to be. So when we look at this spine model, we can see it straight up and down. And that's not the way a spine should look. Instead, when we see this picture that's looking at it like this, we can see that there should be slight curvature that exists. And that curvature occurs in a number of different areas. It occurs at the neck, the cervical region. It occurs at the thoracic region or the back. It occurs at the lumbar region, and it occurs again at the sacral region. So those different areas can have exaggeration of those curves. So let me repeat that again. Those different areas can have exaggeration of those curves. And when you exaggerate the curves, you change the anatomy that's present with it. So if we were to kind of take a look at this picture in depth and detail, and we can see from left to right, there's a description of lordosis, something that's called sway back, something that's called round back or kyphosis, a flat back. And then if you were to take a look at this last picture on the right-hand side, it's looking not at the lateral view or from the side, it's looking from front to back. It's something that's called scoliosis, which most people have heard of, but it's a curvature to the side. So why are all these things important? Well, one of the reasons why is when you get these generic YouTube videos or recommendations of what we have to do and how we have to do that, is certain people have alignments that are different from the general populace. And to try to then change and put them in positions and postures, specifically when we're in that static posture, meaning so when you're stable and you're not moving, your natural inclination for leaning forward or leaning back may not be the same as someone else's, particularly because of the amount of curve that's present. So what are some of the other reasons and indications for why you might have differences in that curvature and that alignment? So these are some of those. One, as mentioned, it could be just purely structural. That can be secondary to differences in bone length of the upper limbs and lower limbs. It can be changes in how the vertebral bodies sort of sit over each other. It can be age-induced, meaning so there's degenerative changes, not just within the presence of the disc, which most people think about, but possibly even in the bone itself. It could be physiologic that's put in place. That could be due to a number of different changes, everything from pregnancy and compensatory changes that are accordingly. It could be pathologic, meaning that there are changes that are secondary to issues with the bone itself, where you have osteoporosis that may result in this. You could have occupational things that cause differences in posture and other things that are associated with it. So what are the resulting factors, and why does any of this matter? Is it always that posture equals pain? No, not necessarily, as you probably have been able to gather, but there are potential consequences, and they include the following. So depending on the posture, you can have different loads that take place at different portions of one's body, where you can have loading of the cervical spine and thoracic and lumbar and other and sacral regions, as we made mention, and it can impact the shoulder, the elbow, the wrist, the thigh. And these are the various different points that you can see. If we were to take a look at a skeletal alignment, we can see it can affect these various different joints if we were to look at it from the front. If we were to take a look from the side, we can see how it potentially impacts these areas, particularly when you're in a seated position or you're putting pressure on the arms or hands. And the same thing when we're taking a look from the back. So what's our literature to be able to document this, as opposed to us just kind of going off the cuff and just saying, well, this is how I feel? Well, these are the various different literatures that we can be able to relate. So we have spinal posture assessment and low back pain published, spinal and pelvic alignment of sitting posture associated with smartphone use in adolescents. We have two other papers that we'll reference later. But at the end of the day, what we want you to know is that this isn't just coming from hearsay or from kind of common talk. What we can be able to do is to show, what do these papers show? What some of these papers are able to suggest is that they were comparing the effects of smartphone use on posture, which we think, now is a big thing. Oh man, if someone is using smartphone and they're cervically bent over, then it's going to cause a problem. And what they're able to find is that posture did change with smartphone use over time, but it actually made adolescents that had consistent concurrent, meaning right now, back pain, actually potentially worsen. And the reason why they thought that was the case is maybe more secondary to muscular endurance and than necessarily the actual issue with the skeletal alignment itself. So take a look at another paper. The use of intermittent trunk flexion to alleviate low back pain during prolonged standing. Sorry for the enunciation and having to be super focused, but I want you to understand what it is that I'm saying. And traditionally, we talk about lumbar flexion, and that's kind of that aspect of us being bent forward. Everyone says, that's terrible. That's terrible. And what we really have been able to kind of deduce is that that's not always so terrible. So for those of you who do that naturally, it may be that you feel better. So let's take a look at what that paper kind of comes out to be. It was looking at when you have trunk flexion, can it be able to alleviate low back pain? And what they were able to do was to assess this. And they actually used a pretty rigorous scale. They used a visual analog scale. They were able to assess it every 15 minutes. And they looked at it at a 2-hour total time frame. And what they're able to see is that sometimes in the right context, it was able to alleviate low back pain by 36%. So more than a third. And what they looked at is they looked at activation of not only the spine posture, but different muscles like the rectus spinae and gluteus medius muscles. And they were able to assess this actually using electromyography, where they're able to kind of be able to assess whether the muscle was fully activated or not. And what they're able to tell is that sometimes flexion can be useful and it can help someone be able to do their job. So why am I basically relating this? Is because it seems to be, when you take a look at most social medias and influencers and such, some of which are physicians, some of which are not, but at the end of the day, there are people who are just saying flexion, 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 always bad, always bad, always bad. And that's not really the case. Another paper looks at prolonged slumped sitting can cause neck pain, and whether that's the case or not. And what they did is they were able to take a look at a number of different individuals. They put them in positions that were the following. And so some of this looks kind of similar, but let me kind of key you in. You can see the slumped position versus the straight up, particularly from the one on the left-hand side, from the right-hand side. But the other things that you can see is how the forearms are. So if you look on the left-hand side of this picture, you can see that the forearms have something to rest upon. And you look on the right-hand side, you can see the forearms aren't rested. And so you would expect that the one that's going to be the worst is going to be D, because it's not only slumped, but the forearms have no ability to be able to rest. And so what they did is they looked at musculature in the back, and the darker the color, the worse it is. And you can see that D is worse, but look at how it compares to A, B, and C. They're all kind of terrible, right? And so even the ones that are supposedly perfect, that sit up straight and support their arms, do not deny having back pain. And so one of the things that they were able to see is that even when the posture is maintained and the back extensors are still overactivated, and you can have constant load. So what we're seeing when we start looking at this and kind of taking and pulling back a bit, is it's not just always about the posture. It's about the muscle and its degree of flexibility and strength. And how do you make that potentially better? So when we kind of take a look at one of the papers that kind of in summation puts this together, is that what they're able to kind of deduce is that it's not always arm support, it's not always back support, but when you talk about that static posture versus dynamic, is there may not be an ideal posture. But at the end of the day, no matter how you're seated, is you may have some discomfort over time if you're not actively activating those muscles. So you see a number of different YouTube videos that talk about how to be able to activate those muscles. And what we've really been able to kind of define is that there's probably, give or take, about 9 key positions that can be able to help improve just the overall flexibility and strengthening. And so what you want to be able to do is to target flexibility in the areas of the thoracic spine in addition to the lumbar spine. And how can you be able to improve that musculature by different stretches? Some of the things that you would see, like the aspect of cat-cow or cat-camel, if you want to use that. You want to look at quadratus lumborum stretching, quadriceps stretching, tensor fascia lata, piriformis, abdominal muscles. And it's not just only core muscular strength, but it's those things in continuum from the neck all the way down to the feet, because they all load the joints, as we've talked about before. At the end of the day, what we want to do is not just wrap someone on the hand and say, hey, you know what, sit up straight because it's going to make your back pain worse. Sometimes it might actually make it better. But the fact of the matter is looking at how can you be able to improve musculature strengthening, not just in the core, but throughout the glutes, the hips, the areas of the legs, as well as the neck and shoulders. It can be able to improve your overall pain and not be reliant upon just simple adages that say, if you do this, then you get that, because we're all different. If you like this video, please give us a thumbs up. If you want to learn more about how to be able to heal both the brain and body and how to really be able to punch pain in the face, please subscribe to the channel. Thank you so much for your time, and tune in next week to learn more about how to be able to get the best out of your life and how to be able to live the life that you deserve. Thank you so much.